Hi, I'm Professor Ian Ashworth, Director of Population Health for NHS Cheshire and Merseyside. I'm delighted to present to you the Population Health Showcase for 2024 to 2025. It really has been a fantastic year of achievements, which I'm very proud of. We've invested in flagship programmes across our 4 pillars of population health that we know will help improve health and well-being and tackle the inequalities that some of our residents face. We've seen our unique model of leadership working with fellow directors of public health across our 9 local authorities, highlighted nationally by the King's Fund as best practice. And as part of our first pillar, which is all about tackling the causes of ill health, we've joined forces with the Health and Care Partnership on its new strategy so that we can work together to create a happier, healthier Cheshire and Merseyside.
To make a real difference in people's lives, we need to join forces and work together as one big team. In Cheshire and Merseyside, we have a great history of doing that already. We're a marmot region and we work together to tackle health inequalities. And now we have our Health and Care Partnership Plan, which we call All Together Fairer, to reflect our marmot work. The plan is our roadmap to improve people's health at every stage of their lives, and it sets out our mission to work together to eradicate child and family poverty.
An independent report has found that over 100,000 children in our sub-region are currently living in poverty. And the scale of inequality is staggering and will have a direct impact on the health of these children, as well as on future generations. That's why we've released a joint statement with our partners across the system and called for an end to this. Because we want to see no child in Cheshire and Merseyside living in poverty. And fighting inequalities will certainly help with this. One example being our work around healthy advertising.
Advertising for unhealthy and processed food and drinks on billboards is driving up our obesity rates, especially among our children. There are enough of these adverts out there without them being on sites owned by local councils, which is why, starting in Knowsley, we changed the rules to ban unhealthy adverts on any spaces we are in charge of. And thanks to All Together Fairer, other councils in the area are doing the same. It's just another example of how we're looking at the wider elements that impact our health, like our work on smoke-free sites.
We're bringing the ethos of prevention into the NHS, thanks to the NHS Prevention Pledge. Our goal is that every hospital in the area has a firm policy on being a smoke-free site. This will help us to encourage our patients not to smoke in or around the hospital and consider vaping instead, so they can quit for good. This collaborative effort can make a real difference, much like our collective mission in Cheshire and Merseyside to tackle racism and discrimination, which we know will change so many lives for the better.
We know that discrimination due to a person's ethnicity can have a serious, long-lasting impact on their health and well-being. For example, black women in England are up to 6 times more likely to experience serious birth complications during delivery compared with their white counterparts. Tackling racism, discrimination and their outcomes is one of the 8 marmot principles that guides all of our work. And as a system, we are committed to creating greater fairness and equity for our ethnic minority communities. Whilst this is considered a social determinant of health, we are clear that tackling discrimination and being anti-racist should be present across all of our work and not just limited to one section or a specific programme. This approach will create the most positive impact for our residents, much like the work in our second pillar, the Supporting Healthy Behaviours programme, and Altogether Smoke-Free.
The Altogether Smoke-Free goal is simple: end smoking everywhere for everyone by 2030. 1 in 10 people in our area still smoke, and numbers are coming down, but there's still much more work to be done. So we've supercharged our efforts this year to make sure this happens faster, with a dedicated programme that brings together targeted support, digital solutions and behaviour change campaigns. We're also working to get as many mums-to-be as possible to stop smoking, ensuring a smoke-free future for every child. And finally, we've joined the Smoke-Free Action Coalition and have been lobbying Westminster to make sure the Tobacco and Vapes Bill becomes law. We even sent down some of our young people to explain why this is so important to them. Stopping smoking can make such a difference to your health. It's the biggest cause of early death. And the same goes for cutting down your drinking, which the Lower My Drinking app has been helping loads of people do.
You might be surprised to hear that people don't often know exactly how much they're drinking and have to think about it. So the Lower My Drinking app is a great tool that I can recommend to my patients. People can use that app to work out exactly how much they're drinking, and if they want to reduce their alcohol intake, it'll help them to do so in a structured and tailored way. We were so pleased with our recent Dry January campaign. So many people saw our adverts, and on the back of that, they downloaded the Lower My Drinking app, and we saw an uptake much greater than we would usually see for these kind of campaigns. So you might be wondering what you could do to be more healthy. So 3 simple things for you. Number 1, stop smoking. Number 2, lower your alcohol intake. And number 3, be more active in travelling to work.
It is a fact that ditching the car for more active travel when getting to and from work helps improve both mental and physical health, as well as help the environment. Our Altogether Active plan is here to help even more people see the benefits of active travel, working with the Altogether Sustainably programme and the NHS Prevention Pledge. We'll be taking a targeted approach to tackling inequalities, which is also a big part of our 3rd pillar and the Altogether Smiling programme.
It's not always easy getting our little ones to brush their teeth, but we all know that it is so important. Many children in our area suffer from tooth decay, especially in more deprived areas. We want to change this, and thanks to Altogether Smiling, we've sent out over 200,000 free toothbrushing packs to children in less affluent areas. This means that the most vulnerable people are getting special support, which reduces inequalities in our health service, something we're also doing with tackling heart disease.
A special project is combining lung health checkups with helping reduce cardiovascular disease, with this focus on our deprived communities. Using data to understand who would benefit most, we are supporting people who may be at risk of lung cancer to also look at their hearts. This means that by getting a lung checkup, someone could end up with coming to a CVD prevention clinic, just like this one, to get help with their hearts before they become a serious problem. This is just one way of reaching our people in our communities. Another is part of our Pillar 4, our amazing Living Well bus.
The Living Well bus is built on the principles of listening to communities and meeting their needs by bringing the right services to them. We are a drop-in service and we travel across Cheshire and Merseyside to well-known locations, providing vaccinations, cervical screening, health checks and mental well-being support. For some of our users, they don't always engage with NHS services, but with the Living Well bus, we can work with them to build their trust over time. Some of the people who've come to our service have never been screened or vaccinated before, and I'm happy to say that we can change that. By offering vaccines to people in places that suit them, we're doing our bit to make sure more and more people are protected and can stay well. We've had loads of great feedback from our users. They love the convenience. They can just drop in and they don't need to book an appointment.
I hope you've enjoyed seeing just some examples of the great work we're doing in population health, but clearly there's more to be done. We have lots of things we want to focus on for the next year, including working with the NHS and our partners to make sure our services really work for local people and communities. We want to make sure it's easy for you to live a healthy life. As well as this, we want to be more proactive about doing what we can to stop the spread of disease by helping more and more people get vaccinated and protected, and also to take up more offers to get screened. We're also focused on putting our data into action in the best possible way and continue to grow our fantastic Population Health Academy that we launched this year. And finally, we want to work with the government to make sure at the heart of its new plan is prevention and tackling health inequalities. And while we're doing all of this, you can help too to keep yourself well and reduce the strain on our NHS. Even something as small like going for a walk in the park can make a massive difference to both your physical and mental well-being. Thank you for watching.